Support for today's episode comes from Amazon, sharing stories and initiatives focused on protecting water resources and strengthening water resilience in communities around the world. Uxbridge School cancer cases prompt state air quality review. Uxbridge High School cancer cases trigger state environmental review. Air quality testing underway. Several female teachers at a Massachusetts high school have been diagnosed with breast cancer or precancerous conditions over the past few years. State health officials began environmental testing this week. Nobody knows yet whether the building is a factor. What the district did next is the part that matters for EHS and facilities leaders. Uxbridge Public Schools Superintendent David Ljungberg and high school principal Michael Rubin notified families and staff on Monday, June 2nd, that several female teachers had been diagnosed with breast cancer or precancerous conditions over the past few years. The district said it had already contacted the Massachusetts Department of Public Health, DPH, and the Uxbridge Board of Health when administrators became aware of the situation. DPH air quality testing is scheduled for tomorrow, Friday, June 5th, at the school. Classes and activities are continuing normally during the review. The school has not disclosed how many teachers are affected or the exact time frame beyond the past few years. One case made public through an online fundraiser involves a 29-year-old teacher with triple-negative breast cancer, an aggressive subtype that is harder to treat than most forms of the disease, according to CBS Boston. The district said specialists are reviewing the cases to assess the statistical likelihood of common causes, and that the DPH has already ruled out the school's water supply as a risk factor through prior testing. What environmental investigators are examining at the school. The review underway covers indoor and outdoor air quality, HVAC and mechanical systems, plumbing and electrical infrastructure, building ventilation, and the historical use of the property site. The school building opened in 2012, but investigators are also examining prior uses of the land, a standard step in environmental health reviews, particularly in regions with industrial histories. Uxbridge sits in Massachusetts' Blackstone Valley, an area historically associated with textile manufacturing and decades of Blackstone River watershed contamination concerns. HVAC systems tend to receive close scrutiny in workplace indoor air quality investigations because improperly balanced or poorly maintained systems can recirculate contaminants or create conditions where volatile organic compounds, VOCs, combustion byproducts, or other airborne concerns accumulate over time. The DPH has indicated there is no evidence of immediate danger and no reason to restrict access to the building while testing continues. Why cancer cluster investigations rarely produce clear answers fast. The Uxbridge superintendent quoted the DPH's own caution directly in his communication to families. Finding an environmental smoking gun in workplace cancer investigations is rare. That is not a bureaucratic hedge. It reflects a genuine scientific challenge. Breast cancer affects roughly 1 in 8 women over a lifetime, according to Dr. Sam Nardello, medical director of the Breast Health Center at Tufts Medical Center, which means multiple cases within a workforce are not statistically impossible without a shared environmental cause. Cancer cluster investigations also contend with long disease latency periods, different cancer subtypes within the same apparent cluster, and the difficulty of isolating occupational exposure from lifetime exposure history. Massachusetts has run long investigations into potential environmental links to elevated breast cancer rates before. Studies on Cape Cod examined groundwater contamination and industrial solvent exposure for years without establishing definitive causation. That history does not mean environmental factors are never implicated in workplace cancer clusters. It means the investigation process is slow and often inconclusive, and that employers and facility operators are left managing workforce trust and legal exposure during an extended period of uncertainty. The employer response standard is the relevant EHS lesson here. What the Uxbridge district did before the announcement matters as much as the investigation itself. School officials contacted DPH and the local Board of Health before going public, worked with epidemiologists and environmental experts to structure the review, ruled out one major exposure pathway through prior water testing, and communicated transparently with staff and families while explicitly discouraging speculation. The DPH publicly commended the district's decision to bring in health officials proactively, according to reporting by the Boston Herald. For EHS and facilities professionals in any sector, the Uxbridge situation is a model of what the response obligation looks like when workforce health concerns surface before causation is established. Employers are not expected to have answers immediately. They are expected to act, engage qualified experts, communicate honestly about what is known and unknown, and not wait for certainty before initiating a review. The final DPH report will be shared publicly with families and staff when the investigation concludes. Sustainability Soundbites water coverage is sponsored by Amazon. Visit the link in our show notes to learn more about Amazon's Spotlight on Water. For sponsorship opportunities with Environment and Energy Leader, please reach out to a member of our team.